Trauma and stressor-related disorders. Trauma and stressor-related disorders are a group of mental health conditions that develop in response to experiencing or witnessing a traumatic or stressful event. These disorders involve symptoms that persist beyond the immediate aftermath of the event and significantly impact an individual's thoughts, emotions, behaviors, and overall functioning. Here are the main types of trauma and stressor-related disorders. Post-traumatic stress disorder, PTSD. PTSD is perhaps the most well-known trauma-related disorder. It can occur following exposure to a traumatic event such as warfare, natural disasters, serious accidents, physical or sexual assault, or other life-threatening events. Symptoms of PTSD include intrusive memories or flashbacks of the traumatic event, avoidance of reminders of the trauma, negative changes in thoughts and mood, and heightened arousal or reactivity. Acute stress disorder, ASD. Acute stress disorder is similar to PTSD but occurs within 1 month following the traumatic event. It involves similar symptoms as PTSD, including intrusive thoughts, dissociation, avoidance, negative mood, and hyperarousal. If the symptoms persist beyond 1 month, the diagnosis may be changed to PTSD. Adjustment disorders. Adjustment disorders occur when an individual experiences significant emotional or behavioral symptoms in response to a specific stressor or life event. These stressors can include relationship problems, job loss, financial difficulties, or other significant life changes. The symptoms of adjustment disorders can vary but often involve depressed mood, anxiety, or a combination of both. The symptoms typically develop within 3 months of the stressor and significantly impair functioning. Reactive attachment disorder, RAD. RAD typically develops in children who have experienced neglect, abuse, or significant disruptions in their early caregiving relationships. It is characterized by difficulties in forming and maintaining healthy attachments with caregivers, leading to social and emotional disturbances. Children with RAD may exhibit a lack of trust, difficulty seeking or accepting comfort, withdrawal, and problems with emotional regulation. Disinhibited social engagement disorder, DSED, is also seen in children who have experienced early trauma or neglect. It involves indiscriminate social behavior, such as showing excessive familiarity with strangers, seeking attention from unfamiliar adults, and a lack of appropriate fear or wariness. Children with ST may have difficulties forming healthy and selective attachments. Treatment for trauma and stressor-related disorders often involves a combination of psychotherapy and, in some cases, medication. Trauma-focused therapies, such as cognitive processing therapy, CPT, and eye movement desensitization and reprocessing, EMDR, are often used to help individuals process and integrate traumatic experiences. Supportive therapy, cognitive behavioral therapy, CBT, and medications, such as selective serotonin reuptake inhibitors, SSRIs, may also be utilized to address specific symptoms and promote recovery. It's important to note that trauma and stressor-related disorders can have a significant impact on individuals' lives and require professional help for an accurate diagnosis and appropriate treatment. If you or someone you know is experiencing symptoms related to a traumatic or stressful event, it is essential to seek support from a qualified mental health professional.